Are there any better treatments and delivery methods that you prefer when it comes to arthritis? I know a lot of pain. Some pain patients dealing with this type of arthritis prefer inhalation via smoking or vaporization. Are multiple applications needed? What have you seen in your practice?
Well, I take a look at whether or not a condition is with the person 24/7 or whether it just pops up. Maybe like migraine would be something that just pops up. Arthritis is pretty much going to be with the person 24/7. I would suggest taking oral cannabis 3 or 4 times a day, probably in a 1-to-1 ratio. You might get relief from as little as 5 or 10 milligrams of THC or CBD, but you might have to go to 15 milligrams of each. And it's going to be effective for about 3 to 6 hours. Now, if for some reason you have all of a sudden walked 3 miles or done a lot of activity, hanging a lot of sheets or something, and you want to have instantaneous relief, then the respiratory route of administration would be what you're looking for. But generally speaking, if people have chronic pain, I think that the oral route of administration is best. Now, if your arthritis is affecting your hands, then I would suggest the topical application of tincture cannabis. As I've mentioned on previous broadcasts, the curanderos, the lay healers in southern Mexico and Central America, have been using the application of topical tincture of cannabis to treat pain in the fingers since sometime in the mid-19th century. And I've had a lot of people who had relatives in Mexico that have told me about this. And of course, as time has gone on, people, Anglos, have become more aware of this, and a number of my patients have mentioned that they're using a topical tincture of cannabis for their arthritis in their fingers, or maybe for their carpal tunnel syndrome, or they've asked me what I think about it, and I think it's certainly worth a trial.
And my mom is not a cannabis user. She has one arthritic finger, and I gave her some topical, about 4 years ago. And so she just rubs it on that finger, and she said to me one day, she's like, "I'll be darned, it doesn't hurt. It actually works." So she has been like our walking billboard of topicals. So
good for mom.
Good for mom. I kid you not, it's so funny. I'm going off. I hope they don't cut this out, but it's funny because she'll be at her church function or bridge game. They'll talk about how funny. She's calling me right now, and they'll talk about. She'll hear conversation of cannabis being brought up. And she'll say, "Well, John and Corinne are in the industry." And so next thing you know, I'm getting all these calls from ladies from church. And one day came back to my folks' house, and my dad passed away a few years ago, but I walk in there and there's a big, beautiful bouquet sitting on the dining room table. I'm thinking, who the heck is sending mom flowers? Well, that's MJ. You helped her. And she just wanted to say thank you. And so I can't tell you how many people at church are walking around taller and in less pain because of the education that we're doing. And a lot of them are following us here on the Sacred Plan as well.